primary goal today is the knowledge of how to apply a compression bandage to a wrist. The first thing you need to do is you need to clarify your order and check your responsibility. Also verifying if it's the right or left wrist. You then want to go and wash your hands. Gather your supplies, which is ace bandages. I have 3-inch ace bandages. And also, this is a self-adhesive ace bandage wrap, and this compression bandage has clips. For ease of demonstration, I'm going to use the self-adhesive. As you can see, it just adheres to itself. Then I'm going to instruct my patient on what I'm going to do. Hello, Brianna.
Hi.
My name is Jennifer.
Nice to meet you, Jennifer.
Nice to meet you. I will be applying a compression bandage to your sprained wrist.
Okay.
Which wrist is sprained?
My left.
I see that. It looks quite swollen. Can you keep your arm right there?
Mm-hmm.
I'm going to next apply the compression bandage, which will minimize swelling, decrease your pain, and provide stability.
Okay.
I'm going to wrap above the injury, which would be the wrist, proximal to the site. It's best to wrap between the fingers and the thumb. 2 to 3 times. If at all it hurts, let me know.
Okay.
1. Overlapping at least 50% of the wrap before it. Being mindful, Brianna is a 15-year-old patient, and anatomically her hands are a little small, and so be mindful that 3 times would be too many around her hand. So twice works fine. After you've wrapped the hand 2 or 3 times, leaving exposure of the fingernail beds and the thumb, you're going to do 2 figure 8s between the thumb, the second digit, the index finger, and the wrist. Keeping out creases, and there again wrapping, covering 50%. There's 1 figure 8 and then an additional figure 8. Making sure you're wrapping firm but not tight. Is that too tight?
No.
You then can proceed down to the elbow for stability. There again, as I mentioned earlier, going back and doing 50% of the previous wrap. Depending on the length of your compression elastic wrap and the anatomic length of your patient, you may not make it all the way to the elbow. But proceed down and then rotating back up to the wrist. Rotating back up to the wrist. So have a little bit of wardrobe malfunction here. So rotating back up. By doing this, it allows it to be stable, and it will keep the wrist immobile. As you can notice, there's no creases, and the bandage overlaps about 50% of the wrap before it. Also, you want to make sure the fingers, nail beds are exposed. And you want to ask, is this comfortable?
Yes.
Are you having any pain with the wrap on?
No.
Okay. Can I leave it like this?
Yes.
Also, you want to check for CMS. CMS is circulation, color for the C. The M is motion, And the S is sensation. First of all, you want to check, you can come in closer. You want to check for circulation. Brianna has a beautiful manicure here. So it's a little more difficult to check for her circulation. If Brianna didn't have a manicure, I will show on my fingers. You check for circulation. You press the nail bed for about 3 seconds, and then you pull your finger up. As you can see, my nail bed is pinkish in color, and when I apply pressure, it's white. And pulling it back up, it returns to the same color. That means there's good circulation. It's blanchable. It's pink in color. But with Brianna and her beautiful manicure, we can check around the nail bed, applying the firm pressure to the tip of her finger and releasing it. Hold for 3 seconds, and then within 3 seconds it should return back to the normal color, which is symmetric throughout her fingers. That would be the circulation, and you're checking for the color. You're comparing, making sure they're symmetric. This hand has a better manicure. You're noticing that the fingers are similar in temperature and color. Motion, can you wiggle your fingers for me? All your fingers? Your thumb? Good. So it's not too tight, it's not too high on her fingers. The next thing you want to look for is sensation. Is there any numbness or tingling?
No.
And if there was numbness and tingling before you put the wrap on, just ask, do you have an increase in numbness or tingling?
No.
And that is how you successfully wrap a compression elastic